Hi, and welcome to 10 Kids, 2 Docs, Parenting Insights from Pediatrician Moms. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. Welcome back.
Welcome back. We are going to discuss breastfeeding, the first thing that a lot of moms do when they become mothers.
Yeah, the very first thing. And today's going to be kind of fun because we're going to start off by talking about this as parents.
Right, like our personal experiences
Mhm.
as breastfeeding moms. And then in the second half, we're going to talk about some recommendations and some experiences that we've had in clinical practice with other breastfeeding moms.
Yeah, sounds good. Let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
I don't know if a lot of moms know this movie, but I grew up in the 80s and there was this movie with Brooke Shields called Blue Lagoon, where these 2 teenagers get stranded on an island, beautiful island, and they're learning how to like function as a love story / Swiss Family Robinson. And, she gets pregnant and, she has a baby on this island. And, in the movie, she just like holds the baby in her arms, like cradles the baby. And then all of a sudden the baby's breastfeeding. I feel like this is kind of like the image that a lot of moms have is just like, I'll just do skin to skin. The baby's head will be just in my arms and like near my chest. And then all of a sudden, bam, breastfeeding, right? And it is so far from that.
I've never seen that movie, Sylvia, but it does sound quite racy.
Well, I mean, in the 80s, this was like kind of like the
Right. I've heard of it.
I'll put a link in the show notes.
Yes.
But it's this image that like, oh, it's so easy, just put the baby's head anywhere near your breast and somehow like they're feeding, right? Why don't you start? Tell us about your mindset while you were pregnant and then that transition to trying to nurse or breastfeeding after that.
So I figure by my count, I spent about 5 years breastfeeding. So I feel like I have developed quite a bit of experience in breastfeeding as I look back. I think honestly, what most surprised me with my first was that it was so painful for me.
It's painful.
Yeah. So I remember, for one, I went into it, I was very disappointed because I had a C-section. I knew that I wanted a lot of children. I knew that having to have a C-section with my first was not a great start to wanting a big family. And I was really disappointed by that. Mm-hmm. So I feel like I was dealing with that emotion while I'm in the hospital with my newborn. It is painful, right? There's settling into it where that really sensitive skin is getting used to the force of the sucking. And then I also learned this whole technique for how to make sure that baby has a really wide open latch, right? I mean, we talk about this all the time with breastfeeding mothers. And I remember at the time in my 5 years of breastfeeding, this idea coming up of, oh, that's a bad latch. We need to start over. Oh, that's a really good latch. I feel like that was something I didn't really fully understand when I talked about breastfeeding before.
Yes, absolutely. And it's not always easy to get the baby on. So I think that sometimes moms will settle for a bad latch. It took me forever to get the baby to start suckling.
Right.
Now that they're on, let's not touch anything. I'll grit through this pain, even if it's a bad latch, because it took that long just to get the baby on, right?
Right. That's really frustrating as a mom. Like, it's already going to take me a good 30 minutes or longer to feed you. I don't have time. Let's get on and start.
And I think very specifically what is painful about it is the nipple is very tender and sensitive, especially if this is your first child. You haven't breastfed before. So this is whole new sensation. And B, the baby doesn't have teeth, right? Newborns don't have teeth, but their gums can sometimes be very pinchy. So you can imagine that pressure of the pinched gums right on your nipple can be very painful. And the pain isn't just, oh, that feels uncomfortable. It can be an acute, ow, that hurts pain, right?
Oh, yeah. And once the baby is settling into sucking, like it could hurt for a few minutes, and then we would get past that hump, but then we would have to switch sides, right? And it's that anticipation again of the pain coming back.
Okay. So number one, the pain. Okay. Let's talk about as things progress. What other realities or difficulties did you deal with?
Okay, I feel like the other one is wearing a bra every night and then leaking milk, right?
Yes.
Remember that? I feel like there were so many months of wearing a bra with the pads in place because if I turned the wrong way and it was about time to feed the baby, I would get wet and it was just more annoying.
Right.
Do you remember that?
Yeah, absolutely. I think it's weird wearing a supportive underwire bra 24/7.
Yes.
The only time you took that out was when you showered and then you're actively leaking milk then.
Yes. The whole like leaking milk. Yes, that's definitely a reality that is not talked about very much.
Or you like look down and you're like, okay, I'm just soaked, right? I've just literally leaked milk everywhere. Yeah, for sure. That's something that every nursing mom deals with too, right?
Yeah. How about you?
Yeah. Breast milk isn't immediately there when you give birth, right? There is this time lag, sometimes women to women dependent, pregnancy to pregnancy dependent on when the milk comes in, right?
Yes.
So there are those lucky moms that at the second day of life, the milk is free flowing and the baby is being fed. But for me personally, my milk came in after 5 full days.
Yeah.
With each of my children, it was still 5 days. Even if it had been less than a year after I last breastfed, it still took 5 full days for my milk to come in. And during that time, when the lactation consultant and the pediatricians and everyone's saying is breast is best, and they're cautioning you against nipple confusion and introducing other milks at that time, it is a lag if your baby isn't drinking breast milk for 5 days. There is a transition that takes place.
Yeah.
And by my 4th kid, I understood the way that it was going to be until my milk came in. But in the beginning, the first and second babies, it was like, what is going on here, right?
Yeah.
And before the baby gets a full feed, a full stomach, the baby is not settled. They can be placated and they can be soothed. But after the milk comes in and your baby gets a full feed, and then they fall off the breast in this milk coma, this full relaxation, and the milk is dribbling out of the corner of their mouth. That state of bliss, I've used this word before, like milk coma bliss, that doesn't happen obviously before your milk comes in. And if you're feeding at regular intervals and giving colostrum, technically that is enough nutrition for your baby until your milk comes in. But there's a lot of holding, there's a lot of soothing, and there's very little sleeping before that happens. So I think with all 4 of my children, there was that 5-day transition period before my milk actually came in.
Yes.
Your first baby and you're trying to nurse exclusively, there are thoughts that go through your mind. I am never going to sleep again.
Yeah.
This baby cannot be put down because they don't have that full feed. So that was a very difficult part with every one of my children. But by the 4th, I kind of knew this is a hump. My baby will sleep someday. For these first 5 days, someone is going to have to hold this baby continuously until that happens, right?
I think that's one of the biggest difficulties about that first baby is that you haven't proven yet that you can do it. I didn't know yet that the pain was going to end. I could read that the pain should end, right? But I didn't know. With the subsequent babies, it still hurt, even though I had breastfed before. But I knew there was an endpoint, like, it's just going to take a week or two. I'm going to fully adjust. And then I also know it's going to be so worth it because it's going to be so much easier for me and good for the baby long term. This is worth it. I can press on. But for that first one, there was this fear and anxiety of what if I just can't do it? What if the pain never goes away? In your case, what if the milk doesn't
never comes in?
Right. You have these worries because you haven't proven yet to yourself that you're able to, you know?
I think by the time I nursed my 4th, I learned so many lessons each time around. Before the milk came in, there was a limit. There was a hold and a position and a latch that I would not settle for.
Yes.
I know how to control you and your head, and I know what a good latch is and how it should feel.
Okay, this has been a fun walk down memory lane so far. Let's go to the guidance we give in our practice, both from the AAP and then from personal experience with patients. So the American Academy of Pediatrics put their guidelines in line with the World Health Organization, which basically says that it's recommended that babies receive only breast milk for up to 6 months of age, and then they continue breastfeeding as part of their diet after that for 2 years, if possible. We used to say for at least 1 year, and then now it's kind of changed to continued breastfeeding as long as you and your baby desire for 2 years or beyond. And honestly, somewhere between 15 and 18 months, every single one of my children just lost interest. I mean, it was such a battle to keep them focused and interested. And they were so interested in solid foods at that point and the calories they were getting from there. They were not getting a lot of calories from breast milk, and they just wouldn't stay on the breast. Like I would try to breastfeed, and they just wanted to be looking around the room and interacting with everyone in it.
Yeah, I think that breastfeeding is one of the most challenging things I think I see for new parents. And it is probably the realm of pediatric problems that I see most commonly where a parent will most likely cry in the office when
Yes.
it's not going well.
Yes.
And usually the context of that is not just the realities that we described initially, like the recovering from the delivery, the adjusting to new parenting, the pain involved, the lack of milk coming in. Like those are all challenges in of themselves. But in the office, sometimes this is coupled with the baby not gaining weight. The baby is still losing weight and is kind of in a danger zone where they've lost over 10% of their birth weight. And then the pediatrician starts putting pressure about feeding and getting enough calories in your baby. That is just an added stress when it comes to that new nursing mom. And during that time, often the pediatrician will recommend supplementation for just weight gain and the health of the baby. And often that recommendation will go against a lot of these feeding plans that the mom had wanted to have. And there is something that gets into moms' minds about this thing called nipple confusion.
Well, the idea is that taking milk from a bottle is less work than taking milk from the breast, and that you're training the baby in a sense that they're going to become lazy. So the idea is if you're continually putting that nipple in their mouth, they're not going to work anymore to have that latch on the breast and that continued suck that they need for the breast.
Yeah, so there's this fear that if they give the baby a bottle, then the baby won't nurse anymore. Not to say that there isn't a baby out there that will find feeding on a bottle so easy that they refuse to nurse or won't latch anymore. But that's the fear of a lot of moms with introducing formula and or a bottle at that early stage.
Yes, yeah.
And then I see a full range of difficulties with nursing after that. Some moms have too much of a milk supply where they are so engorged, their newborn baby is trying to nurse and they're spraying their baby in the face with breast milk.
Yes, yes.
The baby latches on and it's just so overwhelming. They're choking and spluttering and gagging because they're being flooded with breast milk. This mom is just upset and crying because she can't feed her baby. And on the flip side, I see the mom that is on this strict nursing schedule, drinking and hydrating as much as she can. And there's just not enough milk. Baby still isn't gaining weight, although they're feeding at the appropriate interval and taking care of themselves in the right way. So I see this full spectrum of breastfeeding woes. And so every mom feels like there's something wrong with the way that they're breastfeeding. And they wish that it went another way, right?
Yeah.
And then finally, what I see in the office sometimes is that permission that I grant for someone to stop.
Yeah.
Right? The milk is in, their baby will nurse, but it's just not the right thing for the mom. Be it like going back to the work and pumping, being they don't really enjoy breastfeeding, or it's too much of a chore, or it's too much responsibility on one parent. It sometimes is just too much stress on a mom. And I usually engage in a conversation with the mom. What do you want? And this goes back to the whole philosophy of parents taking care of themselves, putting themselves as priority to be a better parent for their child. And sometimes, even though the mom is nursing, it is not the right thing for that woman. And I will often give them the permission. If
Yeah.
it's the right thing for you, your mental health, your sanity, then stop nursing.
Yes.
Done.
We talk about this principle again and again. There's so much benefit to the breast milk as far as the antibodies and everything. There's benefit to that maternal child bonding through breastfeeding. There's also benefit to the countenance that you have in parenting your child, even as an infant. That somehow we know that actually also affects their neurodevelopment. And there can be a point where, whether it's stress or anxiety, and sometimes it's situational that just is completely out of their control, where it's actually best for the baby's development if we are taking any stressors we can off of the parent's plate.
Yeah.
So it's always like a case-by-case balance in that, right?
Yeah. Breastfeeding does not define you as a good mother. And if you are unable to breastfeed, it doesn't mean that you failed as a mother, right?
Right. Yeah, it's funny to think how in just a generation's time, we went from women who were feeling confident that the best thing that they could do for their baby was to put them on formula, to this shift of women who are just devastated if it doesn't work out that they're not breastfeeding. It's funny, I actually was cleaning out our piano bench, which I guess I don't do very often, because I found this parenting magazine dated 2014. And what really caught my attention was the breastfeeding article mentioned on the cover. And there's a comment in there. This is like early in the proliferation of social media. But there's a comment in there that says, choosing not to breastfeed does not make you a bad mother. It's time for women to start supporting one another and stop the judging.
Yeah.
And I just think about how in the 10 intervening years since that article was written, and that was by a lactation consultant saying that, social media has put a big magnifier on the mantra of this is how parenting has to be done. And this is certainly one of those mantras. You have to breastfeed. And if not, then you're associated with all of these other things that you must be doing wrong as a parent, right?
I mean, it does bring back to what you said in the opener, that New York Times opinion piece about placing blame and so much writing on every step of parenting, right? Like we need to ease off on that, right?
Yeah.
It's okay.
Okay, so I think we've done a pretty good job describing the realities of breastfeeding. I think we should talk about the good things about breastfeeding too.
Yeah, right. I think I alluded to this a little bit earlier when I was talking about that blissful state that your baby can get into once they've nursed fully and all their needs are met. They're completely happy and blissful. There is a sense of accomplishment when I did that. I fed my baby to that state, and it's empowering in a way, right?
Yeah. Okay, I was going to say, did you ever have that experience where you would start nursing your baby and you would just be overcome with this need to yawn and feel so relaxed that you felt like you were about to fall asleep?
What do you mean, Vivian? I did fall asleep. All the time.
I remember that physical feeling. It's almost like getting a massage or something, of like those hormones like hit you as the breastfeeding mom and feeling this like wave of relaxation come over you. Not all the time, not all the time. I mean, sometimes it's like super stressful and there's toddlers around you crying and screaming and distracting you. But there were those quiet moments where you would start breastfeeding and my whole body would just feel so relaxed.
Yeah. I feel like it's also very convenient to be able to feed your baby on the spot whenever you need to, right?
Oh, yes. Okay. So, I have children that I breastfed and children that I didn't, because I have children that I adopted. So I became very adept at figuring out the formula ahead of time and making sure we had the bottles and that they were sterilized and that we had the right amount of water and all of that for however long we were going to be out. And, of course, that's like a very easy thing to do for your baby. Of course I would do that, but it is so much easier to not even think about it.
Right.
To not even worry about it. Anytime you need it, it's there. I actually also have this memory of one of my children where I was at a funeral and afterwards somebody complimented me on how they didn't hear my 6-month-old at all during the whole service. And in my mind, I was like, oh, that's because I was literally nursing my 6-month-old the entire time. It was like pacifier. Like eat a little, fall asleep, just sit there, switch sides, eat a little, fall asleep. Like no fussing, because it was like on the go, feed, pacify anytime you need.
Right. Yeah. And I think the other benefit I knew as far as a pediatrician mom is if my baby was ever a little under the weather or one of my older children were sick, I felt reassured that there were some antibodies and protection through the breast milk for the baby as well, right?
Yeah. I will also say that especially when your baby is like at that 6-month mark and they are exclusively breastfeeding, I mean, they're taking a fair amount of volume every day. That's like 500 to 700 calories a day of the mom producing that milk. And I remember that feeling of what it was like to literally be eating for two. Like it was this weird feeling because I was eating more than usual and I wasn't putting on weight. And I know that's not true for everybody, but there's a lot of calorie expenditure in producing breast milk that should not be taken for granted, right?
Absolutely. Yeah.
Anyway, so all that to say, obviously, we love to champion women that want to breastfeed, and we are here to help women breastfeed and to be successful in it and to overcome these trials and frustrations and tribulations that are common to all women that are breastfeeding. And you make me think too, there are lots of resources available to moms who are starting breastfeeding that need help. We've mentioned lactation consultants a couple of times, and I would really encourage women, there's a lot of things that can make it difficult in the beginning. And for many women, if we just give that extra help to get over that hurdle, they can then be successful. So I do encourage people, explore those people that can help you in that journey, because there are a lot of things that can be difficult when you're adjusting in that first couple of weeks.
Absolutely. Use the resources and they can really help you get over some of these initial humps like we described earlier in the episode. I think, if you're a frequent listener of this podcast, you'll see a theme that comes up often where there are pros and cons to, kind of almost every parental decision that you make. And there is also an individualism in parenting. What's right for one family or what's right for one mother might not be right for someone else. And I hope in this episode, people understand that breastfeeding can be a very individual thing. Both Vivian and we both had a lot of joys and we very much enjoyed breastfeeding our babies. But at the same time, as pediatricians, we fully understand that it's not for everyone. So as you move forward in your, decision to breastfeed or decision of when to wean, know that it's an individual decision and hopefully you'll receive support no matter what you decide that's best for you.
Well, this has been a fun walk down memory lane.
This is 10 Kids, 2 Docs. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. We'll see you next time.
We'll see you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.